Hello friends, in this video we are going to discuss about the parietal bone. First, side determination. There is the outer surface is convex and smooth. Anterior-inferior angle is prominent and pointed. Just shows a groove for the anterior division of the middle meningeal artery. Features, that is it having the two surfaces, external surface, internal surface, four borders, superior border, anterior border, posterior border and inferior border. Four angles, that is the superior anterior angle, anterior inferior angle, posterior superior angle and posterior inferior angle. This first external surface having the parietal tuberosity or parietal prominence. The importance of this tuberosity is, that is, it is the important bone in landmark. Then second, the first ossification start at this point. Opposite to this lies the center for written and printed words. Two temporal lines present here. There is the superior temporal lines, then inferior temporal lines. So from the superior temporal lines gives the attachment to the temporal fascia. Above to this line, they cover the cilia aponeurotica, and inferior temporal lines below to this temporal fossa is present and gives an origin to the temporalis muscle. Then parietal foramen. Parietal foramen, through this parietal foramen, occipital artery and the emissary vein pass. Then internal surface. Internal surface having the grooves for the middle meningeal artery and having the sagittal sulcus, superior sagittal sinus here, and the gives attachment to the falx cerebri. Granular fovea and granular pits are present, which are due to the arc knot granulation. Groups, then impression for the falx for the cerebral gyri is present. Then borders. The superior border is straight and thickly serrated and form the sagittal suture with other parietal bone. Inferior border is divided into three parts, that is the anterior, intermediate and the posterior. The anterior is articulated with the greater wing of the sphenoid, the intermediate is articulated with the squamous part of the temporal bone, and the posterior is articulated with the meniscus part of the temporal bone. Then anterior border articulated with the posterior border of the frontal bone to form the one half of the corner suture, and posterior border articulate with the occipital bone to form the one half of the lambdoid suture. Then angles, that is the anterior superior angle. Anterior superior angle form the bramma. It is the meeting point of the sagittal and coronal suture, meeting of the two parietal bone and the one frontal bone. And anterior inferior angle form the pterion. It is the meeting point of the forebone, that is the frontal bone, sphenoid bone, greater wing of the sphenoid, and to the temporal bone and the parietal bone. Then opposite to this lies the center for the Broca's area. Then lambda suture here, that is the lambda is present. Lambda is formed by the two parietal bone and the one occipital bone. Then the asterion formed by the three bones, that is the parietal bone, occipital bone and temporal bone. And temporal bone, mastoid part. Internal surface lies a sulcus for the transverse sinus. Here the transverse sinus ends and the sigmoid sinus begins. Thank you.